Good morning, ladies and gentlemen. My name is Suttipa Suksawat. Today, I will present our study on factors associated with delay in electrocardiogram or ECG time for patients with acute coronary syndrome with ST segment elevation or STEMI at Nakornping Hospital. This research was conducted by our team from the Medical Education Center and Emergency Department at Nakornping Hospital. Next, background. Prompt diagnosis is critical in managing acute coronary syndrome, particularly STEMI, where an ECG within 10 minutes is the standard of care. Despite its importance, limited data existed on the timeliness of ECG at Nakornping Hospital and the factors influencing delays. This prompts us to investigation further. Next, objectives. The primary objective of our study were first, to analyze the time to ECG for STEMI patients in the emergency department. Second, to identify factors associated with delayed ECGs. And the last, to examine the association of delayed ECG with in-hospital mortality, length of stay, and complications. Next, methodologies. This was a retrospective cohort study analyzing data from STEMI patients who presented to the emergency department from October 2009 to December 2023. Key data included patient demographics, comorbidities, and presenting symptoms, time for symptom onset to hospital arrival, emergency severity index, time to ECG, and we use logistic regression to identify factors associated with delayed ECGs defined as more than 10 minutes. Results. Our study included 148 patients with the following key findings. The median time to ECG was 15 minutes. For ECG performed within 10 minutes, the median time was 4 minutes. For delayed ECG more than 10 minutes, the median time was 28 minutes. Significant factors associated with delayed ECG included syncope as a presenting symptom, systolic blood pressure or SBP more than 90 millimeters of mercury, and arrival more than 3 hours after symptom onset. Next, secondary outcome. Interestingly, we found no statistically significant differences in secondary outcomes such as in-hospital mortality, length of stay, and complications like heart failure, heart block, or cardiogenic shock. To conclude, delayed ECGs were significantly associated with syncope, systolic blood pressure more than 90 millimeters of mercury, and late presentation to the emergency department. While delays did not directly impact in-hospital outcomes, they underscore the importance of timely diagnosis in STEMI care. Based on our finding, we recommend first, implement a fast-track STEMI protocol to minimize delays. Second, enhancing triage system to prioritize patients presenting with less typical symptoms like syncope. And the last, educating the community about the importance of early hospital arrival after symptom onset. And thank you to our team at Nakornping Hospital and our co-advisors for their contributions, and thank you for your attention.
And do you have any comments or any questions? Okay, for the next poster presentation is risk factor associated with
Wait. I have a
multiple
question.
recurrent febrile. Okay.
Thank you very much for your presentation. it seems like the data is a bit lengthy, lasting 14 years that you collect the data. So one thing I'm wondering is perhaps there might be like the change in the policy or the regulation or the number of staff or the flow, which might not result in the results being like consistent and being able to use in the real time right now. So, and the other question is about the implication of the research. You mentioned about the policy recommendation to implement fast track triage and educate the community, but I haven't seen the use of the results you get from this research into practice, especially for the systolic blood pressure more than 90, which is like almost everyone. So can you elaborate a little bit how to use your results, especially the significant factors to practice?
Patient with systolic blood pressure more than 90 millimeters of mercury may have been triaged as less critical compared with severe hypotension. Then,
Otherwise, they will be considered shock.
and and เดี๋ยวก่อนนะ and sorry, pardon, please. The first question, I can't remember.
Actually, the first one is just my comment. I have only one question. It's all right.
Thank you.